Well, it is World TB Day, and the Treatment Action Campaign is calling on government to declare the disease a national health emergency. Deputy President David Mabuza is about to receive a memorandum from the campaign in Mbombela, Mpumalanga. Let's take a look at what's happening there at the moment.
Sanibonani. Ninjani? Hawu. Nafika lapha nacula ninenkinga.
Yebo.
Lenifuna ukungitshela yona?
Yebo.
Okay, ngiyabonga. Nganigcina kudzala nje. Sengiyajabula ukunibona. Nginilahlile. Ngisanithanda mina.
Can you hold this for me so that I can be?
Yeah, the audio is very, no one is talking.
How do I hold it? No, this press. No, this one, hold it. Comrades, as we have said that today, as people living with HIV, tuberculosis and other illnesses are here to hand over a memorandum to our revolutionary Deputy President as the chairperson of the South African National AIDS Council. Our memorandum reads as follows. Dear Deputy President D.T. Mabuza, we know that TB is preventable and treatable bacteria that can be beaten. Yet TB remains the leading cause of death in South Africa, killing about 58,000 people in 2019, 36,000 of those were people living with HIV. Last year's global report, the World Health Organization ranked South Africa among the 20 countries with the highest TB burden in the world. In the South African TB prevalence survey, total TB incidence was estimated at 39,100. As members of Treatment Action Campaign, we are gathered here today to urge you to declare tuberculosis as a national health emergency. Diagnosis. Early detection remains key to a successful TB response. Yet too many people with TB continue to go undiagnosed. This is complicated as around 58% of people with TB present without any symptoms. Yet, even those with TB symptoms are not overlooked by healthcare workers. We have seen what strong political will can do, as all patients are screened for COVID-19 symptoms upon arrival at clinics. Why not the same for TB? Instead, it is estimated that as many as 348,000 people remain undiagnosed with TB in the country, 104,189 living with HIV. Through the Richitsa project, a joint initiative between TAC, NAPWA, Sanarela, Positive Women's Network and Positive Action Campaign, we found that 78% of the 400 clinics monitored reported not having urine LEM test available, while about 1 in 4 staff members had not been trained on TB LEM testing. Further, 1 in 5 healthcare facilities has no access to gene expert testing, a rapid molecular test either at the clinic or by referral. We call for everyone to be screened for TB every time they go to the clinic. All people living with HIV with signs and symptoms of TB or advanced HIV disease to receive both urine LEM test and a rapid molecular test. Anyone with a coughing or any duration and other high-risk groups, including previous TB patients and their household contacts, to be tested for TB. We call on the state to set ambitious testing targets and to find and treat those who are not accessing care and stop the spread of tuberculosis. Digital chest X-ray, urine lamp, and other diagnostic tools should be used to ensure early diagnosis of preclinical TB in patients. The call to declare TB a health emergency comes at a time when lip service has been paid about the importance of treating TB and ending TB. Yet critical funds have been diverted from TB and HIV services. For an example, in 2021 national budget, an estimated 5.8 billion was diverted over midterm the next 3 years, despite significant losses in the fight against both pandemics. While the government has a central role to play, we call on all duty bearers, including funding agencies, to prioritize HIV and TB funding in budgeting in order for the state to meet these targets. On human resources, we call for more health workers, particularly those dealing specifically with TB, and more community care workers on the front line of TB response. We know that our clinics are understaffed and overcrowded. Almost 80% of patients interviewed through Richize told us that they must wait in long queues to access healthcare services. And we know that overstretched healthcare workers can become stressed and have little time for patients. Poor staff attitudes remains a major barrier to patients accessing to healthcare. Less than half, 4.6% of patients interviewed through Richize felt that healthcare facility staff were friendly and professional. We note the prevalence in males is 1.6 times as much as with women. Yet the reality is that men are far less likely to go to the clinics to get tested for TB or access other healthcare services. We therefore also call on the government to amplify targeted interventions to reach men. We note with alarm that of the patients in the TB prevalence survey who presented symptoms, 66.6% did not seek care. We therefore call on the state to double efforts aimed at societal behavior change through a radical targeted communication strategy. We recognize potentially powerful role players by other non-state actors in this and commit to assisting as much as possible in this endeavor. TB infection control. 6 simple interventions at the heart of how clinics can be part of turning the tide on TB infection. By following a checklist of good practice, clinics can be safer for patients and staff. Yet very few clinics are actually following the checklist. Through Richize, we found that around 40% of the clinics followed about half of the best practice measures, leaving just under 60% failing altogether. Only 2 clinics succeeded in protecting patients and staff from getting TB at the clinic. For years, we have been calling for checklists of good practice to be adopted. We know it is possible. We have been able to educate people about COVID-19 infection control, to ensure the use of masks in clinics, to screen people for COVID-19 symptoms, to ensure the provision of COVID-19 posters in all South African languages. So these things must be possible for TB as well. The only thing lacking is a political will. Deputy President, we call on government and funding agencies to ensure that all best practice TB infection control measures are adhered to in all clinics and other public buildings. We also urge you to establish a standing committee on TB in Parliament. International level interventions. The state committed itself to targets set in the United Nations high-level meetings on the fight against TB, including on increased financing and prioritizing vulnerable and marginalized population. We call on the government to recommit to these targets to highlight the country's commitment to ending TB. Finally, as TAC, we commit to working with government, with the government, funding agencies, partner organizations, civil society, and all stakeholders in order to make the TB to make TB the priority it deserves to be. We therefore, on behalf of Treatment Action Campaign, on behalf of 7.8 million people living with HIV in South Africa, on behalf of more than 369,000 people who are living with TB, we are handing over this to you, Deputy President.
You must first sign yourself. Then I'll sign. Yes. Sorry? Okay. Let me sign also. I don't know whether it's my desk.
Currently signing a memorandum
What am I signing? Let it be a copy of the copy of
what the memorandum and the president Deputy President is also signing another memorandum from the campaign.
Nanzi Mike it by sanitizing it has been sanitized.
Ngiyanibingelela futhi. Ya bangifundisa lapha ukuthi isebenza njani lento. Sanibonani? Cha sengiyithethe imemorandum yenu. Ngizwile futhi ukuthi ithini. Manje ke nginominister la ubaba Mkhize. Ngizobuya la masinyane. Ngoba niyakhala ukuthi ingathi uhlelo lwethu lokuscreena for iTB lusalele emuva. Manje ke ngizobuya ngisebenze nani. Ngisebenze neDepartment of Health sizama ukuscreena abantu. Ngizoqala ngani namhla la. Nonke nimelanga zoniscreena namhla.
Yebo.
Minister ngizocela ukuthi abonesi balanda izinto zabo. Labantu laba siyabahlola namhla.
Yes, injalo.
Siqala namhla sizoqhubeka. Anihambi ke. Anihambi. Ngizofuna ke ukuthi banivulele indawo nikhuphuke nibe khona la ngizoba khona mina. Sengiyanibona ukuthi niyascreena. Ozotholakala a positive. iTB izokubulala kuphela uma ungathathi treatment. Uma uzothatha treatment ngeke ikubulale. Ngibonga kakhulu ukuthi nisihluphe nisukume phansi ngoba lokho enikukhulumayo enize la ukuzotshela mina anizikhulumeli nina kuphela. Nikhulumela abantu bonke baseMpumalanga. Ihlanzeni district ke i-district enamanamba aphezulu ngokuya kwabantu abaphethwe iTB. Manje kuyofanele sisebenze nani sibathole labo bantu sibascreene bese siyaba initiate ku treatment. Ngibonge kakhulu. Ngizahamba nani manje angisanishini. Ngitholile namhla nizoscreena. Yeah, bese ngiyazi ukuthi bangaka abaphethwe iTB la kini. Ngibonga kakhulu, ngiyabonga. Asambeni.
Sawonga TB, amandla to the leadership with the content siyakulandela.
Ngiyalungisa. Ngizawulungisa screen. We're going back.
That was Deputy President David Mabuza there acknowledging the receipt of the memorandum from the TAC's Anele Yawa. What the TAC asking for is for tuberculosis to be declared a national health emergency. They want that from government, stressing the importance of early detection in that memorandum. Also saying too many South Africans are going undiagnosed, and saying about 58% of South Africans present with no symptoms at all, and they want testing to be ramped up at clinics and public buildings.